Welcome to episode number 53 of the Jen and Jeana Show. Um, Jeana, how are things? We have a guest today.
Yes, we do. So we have a guest speaker, Kim Vopni from British Columbia, Canada, is with us. Kim is a fitness professional who is passionate about spreading information on pelvic health. She is a published author, a passionate speaker, and on women's health and a health educator as well as a mother. Kim is known as the Vagina Coach and has her own podcast show called Between Two Lips. Today, we're going to dive deep into all things with the pelvic health for cowgirls in the saddle. So, welcome to our show, Kim.
Thank you. I appreciate you having me.
Yes, we're super excited. Let's start. We usually start off our show with some grit, grace, and gratitude. And I'll kind of start since I'm talking. And my gratitude today was just technology and communication so we can kind of learn and share across the world. And I got thinking about that this morning. I just think it's really cool how we have advanced technologies now so we can share and promote and learn and all the things. So we're not just close to who we are and what we know. So I appreciate you coming on and doing that too. And hopefully we can learn more. So
love that.
What has been your grace or gratitude lately?
Well, actually today I'll say I'm grateful for sunshine because I was just in Florida for the last 10 days and it was overcast and rainy and cold. I was not in Destin, Florida, but I saw the images from Destin where there was actually snow on the beach in Destin, Florida. So
not what you expect when you go to Florida.
No, I was not prepared, and I've been really cold, and so I'm happy. It's not, I wouldn't say super warm, but I'm grateful for a nice bright sunshine that's beaming in the window and giving me a nice little warm spot to sit.
Yes, that was my gratitude as well. Sunshine, right? And we've had sunshine for a couple days, it feels like, and just not having sunshine really makes a difference to my nervous system. So and then just I'm working through an overwhelming week at school, so my I've had to have some grit to get through that. So
awesome.
My piece. So anything else, Jeana? Why don't you start us off?
Cool. Well, I was going to ask Kim if you would my question, I guess, is if you start to lose bladder control when you're in the saddle or riding, is there a way you can get it back and how?
Yes. So I would say in the moment, it may not be as easy in the moment per se in the position and given the reasons why it may be happening. However, off the saddle, what you can do to help train to be in the saddle, train your pelvic floor to be in the saddle can be helpful. And with equestrians and people who do spend a lot of time horseback and in saddles, they often will develop quite a lot of tension or tightness in the pelvic floor. And people interpret that as actually a good thing. They think, well, I want a tight pelvic floor. But tightness in any muscle, anywhere in the body, restricts blood flow, restricts circulation, can hinder reaction time of the pelvic floor, can create achiness, tenderness, pain for some people. And with regards to the pelvic floor, tightness in the muscles can contribute to pain, can contribute to constipation, can make it so that the pelvic floor muscles can't react at the right time. So when there is some sort of increase in intra-abdominal pressure or repetitive motions that require more support from the pelvic floor, it can become more fatigued more quickly. Its reaction time is hindered and it's not able to generate the force needed for that particular moment. And so off the saddle, working on posture, working on lengthening, not just the pelvic floor muscles, like the musculature of the pelvic floor, but also some of the surrounding muscles as well. Inner thighs are also another one when we think of being on a saddle and how much gripping we do. So lengthening and releasing tension along the inner thighs into our glutes also is going to be helpful, into the front of the hips. Release work can be, as some people would interpret that as stretching, and stretching is one component. Release work could be myofascial release with tools like a roller, like a foam roller, or something like yoga tune-up balls. Could be seeing a pelvic floor physical therapist where there would be an element of manual therapy that could be helping to release tension. People could use something like a pelvic wand for a home treatment that could help release trigger points and stuck tension as well. So I would say it's more likely to help off the saddle to bring you back to being able to help in the moment in the saddle. But when it's happening in the moment when you are on the saddle, it is probably, well, I'm not going to say it couldn't happen immediately for somebody, but it's probably going to be the people who've been riding for a certain length of time during that particular session. And it's going to be a combination of tightness and fatigue. And in that moment, we may not be able to immediately recover that. But with, again, the consistent home practice, we will be able to rebuild that ability to maintain it.
Okay, cool. I know you have some programs out there and stuff like that. Do you have any programs or something that you would suggest or that could help anybody out there kind of looking to tune that all up?
Yeah. I have a program called the Buff Muff program, and there's two levels, I would say. There's an introductory, what I call the Buff Muff method. And this is what, if people ever see me on social media, I'm often promoting this, and I run promotions to get it down at a promotional price. It's very accessible for most people, $17. And the method is a whole bunch of information about what the pelvic floor is, what are some common signs and symptoms that something's not working as optimally as it should, and then of course what you can do about that. And it's not just go home and do Kegels. In fact, it's opposite of that. And it's lifestyle, it's what we eat, what we drink, what we think, how we move, our posture, the footwear that we wear, the type of movement that we do. So it's a whole, I would say it's more of a lifestyle program. But of course, I'm bringing attention to the pelvic floor because that's so central to so many things we do in life. And we don't recognize the impact or the limitations that we face when our pelvic floor is not working optimally. So that's where I recommend people start. If people feel like that's kind of like a DIY program, you watch my videos, you do what I say in the videos, and it's kind of you do it yourself. If people want more support and guidance and kind of a bit more hand holding, then the full membership is, you can go monthly or yearly, but that's where people get access to more things, more information, more techniques, coaching with myself. And I would, like, most people end up choosing that because we've never been given any information about this. And it's a bit of a shock. When you learn that you're not the only one and that this is how common it is.
Yes, so much so, right?
Yeah.
Yes.
Then people are like, okay. Yeah.
Yeah. Because everybody thinks everybody thinks they're the only one.
Yes.
And it's we just don't talk about it, right?
Yes.
So I would love that piece of it, right?
Yeah. So they come into the community and they come to the coaching calls, and we have a community forum where people can ask questions, and they're like, oh my God, I'm not the only one. And they can learn from one another's questions. They can learn from what's asked on the coaching calls. And some people come into the coaching calls with kind of like deer in the headlights, and they have no idea what's happening. And they're just sitting there like flies on the wall, and they come away at the end. They go, oh my God, I didn't even know that I needed to know that information. And so it's just a way for people to feel not alone. I know a lot of our health, I call sick care systems, medical care systems are a little bit broken, and it's very difficult to find good care, find it quickly, know what questions to ask. So it's a way that people can also come in and arm themselves with information that allows them to better advocate for themselves when they're speaking with their care providers.
Oh, I love that aspect, right? Because our systems really are that they need to, but then they just get told that it's not a problem, or it's no big deal, or after
that's just what happens when you have babies.
Yes. Or your average, that's normal.
Yes.
Yeah.
Yes.
Right.
Yeah. But there's a lot of dismissing, and a lot of a lot of women talk about how they're validated by coming into this community, and they're not crazy when they've been told they're crazy. And that is affirming. And then they now have language that they can now go back to that same care provider or somebody different and know what questions to ask, know how to advocate, know how to what resources to bring to educate the providers. Because sometimes it's a lack of education on the I'm going to use medical doctors for a big example, that it simply is not in their realm of training. It's not their fault. It's just the system that they're trained in. And so being presented with information that they could choose to go and investigate or not, but at least it's a way of trying to move the needle forward.
Cool. No, I love it. I listened to one of your podcasts and I was thinking that too, because even when I'm a mother as well. And like, I didn't even know there was an option like, oh, you can actually do things so you don't tear or you don't do that. I was like,
Yeah,
that's a first to me, and it's comforting knowing that there is options out there that you can do. So I'm glad you're doing what you're doing and you have these programs available for sure.
Thanks. Yeah, it's fun. I love what I do. I feel very passionate about it. And I love seeing the transformations that happen in all sort of like the oldest participant I have is 93. So it's never too late to make change, which I love seeing that. The women who come in their 70s, 80s, and they get back to having sex again, they are exercising again, they have a social life again. That's huge. And from a longevity perspective, we need all those things. And when the pelvic floor is holding us back, it makes life really small.
Yeah, no, I totally
How
agree.
much confidence does that give them just in life, right? And keeps anybody moving forward, just if you can feel better about yourself.
Yeah, 100%. And it just like for their interpersonal relationships, for their bone health, how many women are stopping exercise? We have evidence to show this. There's a huge portion of women who stop exercising because they're leaking, because they have urges, they're afraid there's not a bathroom, because they think it's going to make their prolapse worse, or they've been told by their care provider that they should not lift anything over 10 pounds for the rest of their life. That's kind of infuriating to me, because there's a lot of things that they do that they could be lifting a bag of groceries that's over 10 pounds, but yet they go to the gym and they're like, I just need to lift the 5-pound weight 1,500 times. And we can do things differently. So at the limitation of trying to protect the pelvic floor, they're also now increasing the risk of osteoporosis, increasing the risk of diabetes, increasing the risk of heart disease, and we can go on and on. So let's optimize the pelvic floor so that we can lift more than 10 pounds, or so that we can trust that we can lift more than that, even though we probably already are in many of the activities of daily living. Rather than putting limitations on people, let's open up the door of possibility.
That shift in mindset. Yeah, go ahead.
Yeah, it's okay. So say if my question when we were talking about that was like, say if you did try your program or something, how soon would you start seeing results, or so they can get more confidence and, that sort of thing? Like, say if you had issues, what would you suggest, or kind of what have you seen in the norm?
It can really depend on what the person's struggling with. So I'll talk about sort of the three main things that people come to me for. Bladder challenges. So a big one is that they feel like they go to the bathroom all the time, including at night. They're up multiple times, 3, 4, 5 times a night to go to the bathroom. One of the quickest shifts that people have is being able to sleep through the night, because they recognize, once they have the appropriate information, that they've trained their bladder to do that. And just as they have been doing things without necessarily knowing it's contributing to a problem, once they have the information of how to put new inputs in and do things differently, I was just at a business conference, and one of the gals who was there with me, who is a bone health coach, she and I were talking a lot about our businesses and what have you. And then that topic came up with something that's in her community. And she said, well, I do that too. And I gave her the tips. And the next day she said, I didn't wake up last night. And she messaged me the other day. She's like, 5 days in a row. So that can happen literally right away.
Cool. Okay.
That could be a big change. In terms of people who are dealing with things like leaking, stress urinary incontinence, laugh, cough, sneeze, jump, I leak a little bit of pee, I put pads in all the time. That, I would say, if somebody is consistent, then it can be about 2 weeks. I wouldn't say it's always an elimination completely, but most people are noticing a definite improvement by about 2 weeks. In terms of pelvic organ prolapse, which is also another reason, a very common reason for people to come, that is where the bladder, the uterus, and or the rectum can start to shift out of their optimal anatomical position. They can bulge into or descend into the vagina. And this is more common than incontinence, actually, but not talked about. We don't see the ads that say that late bladder leakage is just part of being a woman, which I don't agree with. But we don't know. People are very sidelined by this diagnosis because they've never heard the term, and all of a sudden they are now dealing with this bulge, and they're saying, "How the heck would?" And sometimes they think it's cancer. It's super scary. And if we catch this early, we have an opportunity, especially with the bladder and the uterus, to potentially reverse it, or at very least improve it. But so many people, again, are kind of, they don't associate the symptoms with what's going on. They're not talking about it with their doctor. And then it's sort of a gradual progression. And one day they have this bulge, and that can be a little bit more difficult to completely reverse. Not to say you can't improve it, but length of time for that to change, I find it's usually, maybe a month, they might feel they will feel some improvement. If you're early stage trying to reverse, it's probably going to be a 2 to 3 month-ish mark. And for some people, it'll be a bit longer than that. So it's very variable, but change can happen very quickly. One thing I want to say on that, though, is I've already said one thing, which is it's never too late to start. But I also want to say that the consistency piece in applying it at the start, and also the consistency in continuing to apply it, even if you did reverse the condition completely, is so important. We go to the dentist once or twice a year. We brush and floss in between our visits, and we go to the dentist even if we don't have any toothache or symptoms or anything. We still go because that's what we've been conditioned to do, and they do the checkup. And if they say you don't have any cavities or any issues, we don't stop brushing and flossing. We carry on until our next checkup. So I think this should be what we're told much earlier in life. You see a pelvic floor physiotherapist once a year for a checkup, and the brushing and flossing is all the different types of pelvic floor muscle training that you do. And you don't just do it to fix a problem. You do it to overcome, but also maintain function for the rest of your life.
Cool. Very exciting. Jennifer, do you have any other questions?
Well, no, I love the idea of the bone health, right? Not the idea, but the idea, right? That it's a limiting factor, and bone health is such a predictor of our longevity and fall risk and things like that. But then can you kind of touch on, right? In my mind, right? The foot pain and the foot alignment with the pelvis alignment. I think that's just a fascinating connection.
Yeah. So again, I think of the conditioning that we have as we're growing up. Even if you think of babies, we put babies into shoes that start to cast our feet into specific positions, rather than footwear that allows our feet to feel the ground and move. So if you could imagine, like with our hands, our fingers move around, and we use our fingers in all sorts of different directions all day long. If we had a sock put on our hand and we didn't have as much dexterity, we couldn't expand our fingers as much, we would ultimately become more restricted in what we can do. And those muscles would start to adapt to being closer together, not having the full range of motion. The same thing happens in our feet. So by wearing socks, by wearing shoes with narrow toes, by wearing shoes that have an elevated heel, and this can be what even a lot of people consider a neutral running shoe, will often have a positive heel, meaning the heel is higher than the forefoot. And the adaptations, seemingly small, that happen up the chain to our calf muscles, to our hamstring muscles, to the position of our pelvis, to the position of our head and shoulders, we need to make accommodations for that heel elevation, even if it's, doesn't even have to be a high heel. It could be just half an inch. And the adaptations that happen are often shortening of the back part, the hamstrings, the calves, tucking of the pelvis. We start to get a bit more rounded in the shoulders, which all will interfere with the alignment of the pelvic floor and the diaphragm. So our diaphragm is our breathing muscle. When the rib cage is over the pelvis, the relationship between the diaphragm and the pelvic floor would be considered more favorable. And that's where we have the best opportunity for the pelvic floor to be at its optimal resting length and respond with the right time, with the right amount of force to whatever it is that we're doing. If we have short, tight hamstrings, our pelvis is tucked under, especially if we get changes to our spine, and we might now have a pelvis pushed forward, or we might be leaning back, that relationship or alignment is going to be not as favorable. So that's going to create some tension in the pelvic floor. We're not going to be able to breathe as well. We're not going to digest things as well. So by changing the footwear, and this is something that we don't just say, oh, I heard Kim Vopni talking about minimal shoes, I'm going to go start wearing minimal shoes. We have to adapt to that. We need to gradually progress to that new footwear to give our body time to adapt. But progressing to minimal footwear, or barefoot shoes, some people call them, in my opinion, is a really good idea for not just our pelvic floor, but also how we hold our body in space, our alignment through our joints, and how we load through our joints. So from a bone health perspective, when we have that shortening of the back legs and the tucking of the pelvis, we no longer load appropriately through the ankle, through the knee, through the hip. And we need to optimize the alignment by changing the foot first. And then we can better translate up the chain, if that makes sense. So that's one thing. But the feet also, when we look at aging, especially, I look at a lot of, the term geriatric shoes. They are incredibly restrictive. They are very narrow in their base. They don't have any spread for the toes. And I think if this population that already typically is challenged from a balance perspective, to put them in a shoe that now doesn't allow their feet to adapt to the ground is I think irresponsible, really. So much earlier in life, we should be transitioning to minimal footwear and being able to load appropriately through the joints from a bone, being able to do impact exercise, being able to do resistance training with a pelvic floor that can manage those loads so that we are offsetting this age-related bone and muscle loss that we face.
Oh, I think 100% right. Because I think people often will just say, oh, it's just getting old, or that's just how it is as you get older. And really, it's not. It's how we've been set up as society of that expectation. And we can really impact people and make changes that.
Yeah. And what we accept, just because there's some things that are common doesn't mean that we need to accept that as normal and just sit back and let it happen. I think we give over so much to that statement of, oh, I'm just getting older. Let's fight against this and let's improve our health span. Let's improve our longevity with things like loading through the bones, the joints, optimizing the pelvic floor. Small little changes can make a huge change in terms of our health span, not just our lifespan.
And our quality of life.
Yeah,
for sure. So what would you say to somebody, like what are like the mental piece of it, right? Because I hear you saying, right, there's these exercises and things we can do, but I've heard you talk about like the impact of sleep. I think you probably will talk about like the nutrition and all of those pieces. Like, I don't even know what my question is other than how do you help people have a mind shift change to do that, I guess is my question.
A statement that I say often is choose your hard. So I get people to think about when they come into the community, I get them to think about what was the decision that brought you here? What was the pain that you were experiencing? It doesn't have to be pain, but what was the impetus for you to make the decision to, I think this is something that can help me. So think about what that is that you want to overcome. I want to stop wearing pads. Sex hurts. My vagina is dry. I'm leaking, whatever it is, whatever the reason is, think about that. But now think about what is the why behind that. So I want to stop leaking so that I can. I want to get my vagina, the vaginal dryness under control so that I can. So I have them kind of fill in the blank of so that I can. What is their why behind this? And it's things like, so I can play with my grandchildren without worrying about my prolapse, so that I can enjoy intimacy with my husband, so that I could, have a new sex life, like women who are in their 60s, 70s, 80s, who may be single and now pursuing a new partner, so that I can participate in whatever I want without having to think about where all the bathrooms are, so that I can ditch the pads, whatever it is. And then put that up somewhere where you're seeing it every day. And if you have a day where you're maybe not as motivated, come back to that statement, but also then ask yourself, like, what is harder? Is it harder to stay in this place of dealing with the symptoms that are holding you back? Or is it harder to take the 10 minutes for yourself that's going to move the needle forward? And it's, some people can come into the program and get a little bit overwhelmed, and I try to break it down into as much of a digestible flow as possible. But just watch one video a day. Watch one video a day. Remember your decision. Think about your why, and then choose your hard.
I love it.
Are your, speaking of time and stuff, is your programs like, do you need to reserve like 10, 20 minutes a day to get through the video on your exercises, or what is the time slot usually?
When they first come into the method, there's about an hour's worth of content in separate videos that they watch. So again, it could be one a day. They could watch the whole series and be done in an hour. Then they get to the exercises, and that is building up to the point where they would be doing a 10 to 15 minute workout every day. So in the first couple of weeks, they're digesting the information, they're learning the foundation exercises. I give them a few follow along workouts to practice.
Yep.
And then I put them into what I call the Buff Muff Challenge. It's a 28-day, 10 to 15 minute workout every day for 28 days to establish that routine, to show them the variety of movements, to take them beyond do your Kegels, like do the 300 Kegels a day, and make it fun and engaging. And that's where the transformation happens, is usually in that 28-day challenge. So 10 to 15 minutes a day. And that could very well be your maintenance program going forward. I usually will progress them into another challenge that has more dynamic movement, has heavier weights, more sets and reps, because we want to progress. We want to give the body those, the new inputs that create the reason for an adaptation to get stronger. And so it's dealing with their bone health and their heart health and their mental health and of course their pelvic health too.
Awesome. That sounds amazing. And really you should take 10, 20 minutes if that's all you can get, but to benefit yourself and work on yourself every day anyway. So yeah, it's
we deserve it. And we never put ourselves at the top of the list that we have every day, right?
Right.
Everybody else seems to come first. And when we put ourselves first, then all of those other things on our list become a lot easier to do, because we have given to ourselves first, and our symptoms start to improve. So we are less distracted. We are more present with the other things that we do throughout the day. So we really deserve that attention. And that's a big part of the messaging that I send to people is that should be reserved for you. You deserve to be at the top.
Yes. Good for you. No, I'm glad you're sharing that. That's very important. I agree.
Yeah.
Agreed. Yes. Cool. Jennifer, you have any other questions or brain body connections you want to ask or get into?
No, I just love it though, right? Because some pelvic therapists that I've referred to or whatever sent people to or back and forth, right? But I think how your method incorporates the whole piece, right? And really giving them their why and moves the needle forward for them. And that way you get that buy-in and
the commitment to it.
Yes. So
yeah,
I love it.
Yeah. One more thing, if I can, just to leave people, a lot of people that come to my community are in the perimenopause, postmenopause phase of life. And many of them have been struggling for years, thinking it's normal, thinking it's just part of aging, thinking that's just what happens after you give birth. Some people have never given birth and they still struggle with these challenges. And then that's oftentimes they're wondering like, well, how I wasn't pregnant. They often think that's the only way you develop these symptoms. But when we get to this point of the perimenopause transition, where we're transitioning into this post-menopause phase of our life, which could be a third of our life, we could spend 40, 50 years in that phase of life. There's a hormonal component that I also want to highlight. So while we talk about nutrition, while we talk about posture, while we talk about exercise, lifestyle habits, there's also a hormonal shift that really needs attention. And there's a new terminology that's used called genitourinary syndrome of menopause, which encompasses genital changes and symptoms, sexual signs and symptoms, and urinary signs and symptoms under this umbrella term of GSM, genitourinary syndrome of menopause. So if somebody has been able to kind of manage or maybe even ignore symptoms, or maybe there hasn't even been symptoms up until the point where we have this transition with the change in our hormones, now all of a sudden the little screams are becoming, or the little whispers are becoming screams, or there's symptoms showing up for the first time. So there's also a really important conversation that needs to be had around hormones. And that can be hormone therapy systemically, but more specifically, local vaginal, especially estrogen. And estrogen is very scary to many people. And that's thankfully, it is debunked in terms of where that information came from, but the world is still behind in accepting that. So it used to be before the Women's Health Initiative, which is what created a lot of the fear around hormone therapy and estrogen. That study falsely portrayed information that took 40% of women who were on hormone therapy down to about less than 1%. We are now currently 20 plus years later, only 4% of women are using hormone therapy. And especially for vaginal estrogen, this is safe for everybody. I argue that it is an essential nutrient from the age of menopause onwards, from the start of your menopause onwards for the rest of your life, to help mitigate all of those symptoms that we were talking about earlier. It can help with incontinence, can help with urgency frequency, can help with prolapse symptoms, can definitely improve painful sex, and it reduces the risk of UTIs. This is something that, especially if you have been prone to UTIs as you approach menopause, recurrent UTIs are so often treated with recurrent antibiotics. And eventually they can become sepsis and it can become life-threatening. So if you are listening to this and you are around the age of menopause or even post-menopause, please speak to your doctor about vaginal estrogen. And I have a whole podcast episode about this. I have a whole blog article specific to vaginal estrogen and other helpful therapies for vaginal dryness.
No, thank you for sharing that. And it is very real. Yeah, my father-in-law, that's pretty much how he passed away too, was urinary tract infections, and then it went, septic. And so it can happen in men, it can happen in women. It's part of it. And the same, it's a nasty cycle that we really don't have a solution for, or if you go to your local doctor.
Yeah, we do. We have the solutions. We just, unfortunately, within the medical system, it's not again, the training. And again, because of it used to be, but then because of that one study that scared the pants off everybody, then it's, people are still slow to catch up. And I'm sorry to hear about your father-in-law, but that is another, it happens.
Yeah, it does. No, for sure. Yeah. Cool. So they can also, do you also help guide in that, or trying to figure out if you do need that, or do we go to our doctors, or where do we go for that information?
Yeah, I am a menopause support practitioner. I am certified. I cannot prescribe. I'm not a doctor. So I will provide information and guidance and resources for people to then do their research and take it to their care providers. So vaginal estrogen, there are a few low dose, vaginal estrogen is already very low dose, but there are some over-the-counter options on the market. I do still recommend speaking to a doctor and, just because we all have our own unique health histories, but that is typically something that does need a prescription. And a couple of great resources. There's a book called Estrogen Matters that I highly recommend all women read. I also recommend the book called The Great Menopause Myth. And those two books, I would say, cover the gamut. And one is more medical allopathic medicine. One is more bioidentical, non-allopathic functional medicine approach. And so you can choose which one aligns best with your beliefs and your values, and then bring that information to your care provider, your care team, and make the decision that's best for you.
Cool. Thank you for those references. Cool. I had one other quick question, kind of the opposite of of what we've been talking here, is say if somebody is wanting to become pregnant or riding and a cowgirl, that sort of thing, is there things to do prior, for a better pregnancy and, more control afterwards and during and all those things? Do you have some things for that as well?
Mm-hmm. Yeah, the work, when I started in this realm, I was working primarily with pregnant women and then transitioned to including postpartum, and then now include kind of the full gamut. From a prenatal perspective, I recommend, even before you're pregnant, see a pelvic floor physical therapist. And this is something, again, I wish we knew of this much earlier in life, so that when we become sexually active, we know that having a pelvic floor physical therapist on our care team is valuable, and we would see them once a year for a checkup. So preconception, ideally, see a pelvic floor physical therapist just to get a baseline overall check of what's happening in the pelvic floor, making sure that the person can contract and release or let go of the contraction, so that they have a good balance between effort and ease, and a balance between both sides. Some people can develop tension more on one side than another. During pregnancy, you can also see your pelvic floor PT. They may not do internal evaluations as often or at all, but they can monitor posture changes, breath changes. Of course, there's hormonal changes that are happening during pregnancy. And then postpartum, I always say pre-schedule your postpartum visit for around 6 weeks. You can go sooner if you need, but generally a postpartum visit around 6 weeks, and allow that your pelvic PT to guide you to return to horseback riding or higher impact activities. And it's well beyond 6 weeks. So most of us have this 6-week green light, which superficial tissue healing has happened at 6 weeks, but we need to retrain the pelvic floor as part of a deep core system and gradually load it rather than just being like, oh, I'm 6 weeks, I'm ready. Everything's fine and healed. And now I can go back to doing exactly what I did before. In terms of preventing tearing, seeing a pelvic floor PT is one. Perineal massage is something that people can do, and this can be done manually with like yourself or with a partner. There are some devices and tools. One's called the Kegel release curve. There's pelvic wands. There's also something called the Epino, which unfortunately is not available in North America, but it is available in Europe and Australia. And this is what I used in my pregnancies and what got me into this world of pelvic floor health. So Epino stands for no episiotomy, and it's a biofeedback device that allows women to see when they're contracting and relaxing. And also perineal massage is sort of like preparing the tissues, experiencing discomfort and stretch and pressure, and then learning how to relax and find ease and surrender when you feel that. And that's a lot of what the Epino does as well. So I love that. I feel like it should be available to every single person that's giving birth. And releasing tension. So especially the people who have been riding and spending a lot of time in the saddle, again, releasing tension in the inner thighs, releasing tension in the pelvic floor and the glutes and the hips, optimizing the posture, making sure that alignment between the diaphragm and the pelvic floor is optimized. And not think of, oh, I've got to do Kegels and make my pelvic floor really, really strong. It's that balance between effort and ease, and arguably more important, finding the ease and surrendering when you're pregnant.
Cool. Well, thank you. No, I appreciate your information on this. Hopefully it'll help some cowgirls down the road for sure.
Mm-hmm.
So yeah.
Well, thank you. Yes, very much for sharing your knowledge and time with us today to help enlighten. And just, I think it's all about information and passing that information along and getting it to the right people so that they can take charge.
Mm-hmm. Yeah. Thanks so much for having me and helping spread the information.
Yes. Well, thank you guys for listening to the Jen and Jeana Show with grit, grace, and gratitude. If you think this episode can help one of your family members or friends, please share it and subscribe to our show or to Kim's show, Between Two Lips. And don't forget to get a little gritty, give yourself some grace, and send some gratitude. Alrighty, we'll see you guys in the next episode.